AL amyloidosis, it's amyloid light chain amyloidosis. So it is caused by it's considered a plasma cell dyscrasia. In other words, the plasma cells, which are the cells that produce our immunoglobulin, our antibodies in our body normally, plasma cells have gone array and they're pumping out these light chains, overproducing these light chains. And these light chains in the disease, they misfold, they aggregate, clump together, in other words, and they deposit in our end organs. And in AL amyloidosis, those organs involved include the kidney and heart. And unfortunately for patients with AL amyloidosis, they suffer heart failure, and that's the usual cause of death for these patients. It's a very rare disease, about 60 to 120,000 patients worldwide. It live with the most advanced form, Mayo Stage IV. There are many staging categories. The staging category you'll see in the paper and that we're using in our current trial is a 2012 Mayo staging, and that categorizes into stages 1, 2, 3, and 4, 4 being the most advanced. So the number of patients I quoted are those with the Mayo Stage IV, the most advanced form. And these advanced patients, they die from cardiac failure quite rapidly. Typically within 6 to 9 months is when they die. So it is the most advanced form, and that's the target population of the paper, the post-hoc analysis paper, and that's the target population of our new study, the AFFIRM phase 3 study. Birtamimab is a monoclonal antibody, and it was designed to target these misfolded light chains. And it's specifically designed only to target a epitope that is exposed when the chains are misfolded. And Birtamimab targets both kappa and lambda. There are two types of light chains, kappa and lambda. Birtamimab targets both kappa and lambda light chains that are misfolded. And Birtamimab is designed to remove the aggregated pathogenic chains that are in the plasma, as well as those that have accumulated in the end organs. And that's important because there are treatments that are given to reduce the production of these light chains. Myeloma type drugs that are already used and are given to patients to reduce the production of light chains, but nothing is available yet to deal with the light chains, misfolded light chains that are already circulating and already accumulating in the end organs. And so Birtamimab is designed to target that, the damage that these light chains are causing. And so we think that, and we hope, and we have the data from the VITAL phase 3 post-hoc analysis show that can improve the outcome of patients. And it can, if you've seen the paper, it reduces the mortality of patients with Mayo Stage IV, the most advanced form of this disease. And so just to quote a couple pieces of data from that paper, if you haven't looked at in detail, we had an overall 74% survival in the Mayo Stage IV patients with Birtamimab at 9 months versus only 49% with placebo patients receiving placebo. So really significant benefit in these patients. Hit a p-value of 0.021 and a effect size of 59%.